Okay. So I'm going to talk about the dental prevention of suspected case, which has prone to break easy. And it was a little bit difficult titles. I have a lot of presentations, but according to Mohammed Issa, he want prevention this year. Over. So, okay. The outline I'm going to talk about if you have white root and what's happened and what's the management to avoid any trauma, and protruded maxilla, short roots, plus we have condition of cerebral palsy. So, you know, the development of the teeth, I'm sure most of you know that started from the crown, then developing the root with wide canal. So we have stage 1, as you see, can see in the X-ray here, there is a little bit different between stage 1, stage 2, and then with time start to become narrower and the apex start to close. Finally, we have this result. It's maybe by 11 years. So the tooth erupt 8 years plus minus 6 months. Then, but the root still open apex. And that time is critical if he has received any trauma. This is from old books I found. Not really as supposed to be, but nice features. Yeah, there is two child here, two children, two boys. One of them is 9 years old, and the other is 11 years. Just to explain, if the different stage has received different time trauma. For example, the child at 9 years received a trauma which make needs pulp therapy, totally different than who have close apex. So that's what I'm talking about. Any trauma resulting with, you know, that's the reference says it's prone to trauma. What we have here, yeah, this is one of my cases. He has received trauma to the two teeth together with open apex. Of course, it's immature canals. And as you see, there is lesion in the apex area. It means we need root canal treatment at this age. So of course, first visit we have to clean. Second visit, maybe we put calcium hydroxide for disinfection, not for epissifications. No more epissification, as I talk about this last presentations. And then we put final restoration and good sealed. As you see, even the lesion almost disappear. So what is the management? First of all, we have, of course, to provide good root canal treatment. Second things we have, is this working? Yeah, we have to put, oh, cannot. Okay, here cannot, yeah. We have to put here composite. Now, you know, many cases we have fantastic root canal treatment, but then we see gap between cotta partial and maybe IRM and then composite. In this case, we have suspected to be broken. So we're supposed to build up composite even a little bit below the bone. So that's like, but of course not post and core. We're talking about bonding materials. And then we have another problem, which is not related at all to the development of the tooth. This is like disease. as action of classic cells stimulated, inflammation of the pulp. Etiology, nobody knows really about it, but we're talking about trauma most of the cases, and cavity sometime. Prevalence 0.01 and 55 depend on the inflammatory status of the bulb. Of course, according to the Shannon 2010, he said we have to do pulp therapy once we see internal root resorption. We have to, otherwise it will make more internal, the dentine internal root resorption, and the tooth may break. However, if we have such a case, I think this is, everybody know here, this is poor prognosis. But we should do something to keep it if the patient is below than 18 years old. Why is that? Just to preserve the bone. As you know, we need bone to make beautiful implant and prosthesis. Now, if we have protruded maxilla and short lip, they are easy to get break teeth in any trauma, because the tooth is forwarded to the other part of the face. There is a study by Yaman 2017, it's a recent study. He approved that. So we have protruded and short lip. Different cases, and this another case is in severe case. You see this, actually, you can see it's like 9 milli overjet. So the face is coming like this, the tooth coming out. Any hit, the first part will receive the tooth. So the management, of course, we have to, if the mandible is small, we have to bring it, to make it bigger, and to bring it forwarded, and there is functional appliance to do that. And as we know, this non-specific coronal cells in the joint help us rest of the life. You can increase the length of the mandible. And we have, of course, we have twin block during the mixed dentition, so we can improve the relation between maxilla and mandible. While if we reach, still we have chance to increase the size of the mandible using Herb's appliance, which should be with the permanent dentition. So this is one of my case, but I haven't do it alone because I'm not ortho, I'm pediatric. So you see sorry I could not find intraoral pictures, but she's my daughter anyway. So we have here, and we have here like ideally 1/2 milli. This is, but she struggled really. She used all kind of appliance to avoid the surgery. Now she has beautiful overjet relationship, and she's now in London studying at the college. However, now this is her mother picture actually. Yeah, she received. You see, I don't need to find patients. I just ask my family. Yeah, let's go back. So we have short roots. It's like baby roots tooth, right? It's like baby tooth, but it's permanent teeth. She went behind me to the orthodontist, and she did all this behind me. And she told me that Hamad Hospital only morning, Al-Wakra. She has no time to go to Al-Wakra morning, so she select and she paid using my Visa card. And then this is the result. I don't know how she selected, but her own way. So now she has serious problem. but the teeth is still there. However, this implant done in my hospital, so don't worry. In the Al Wakra hospital. Finally, recently, 3 years back, I started to see majority of my cases only special need, because as a pediatric, it's one of my missions to see a special need. As you know, in all the total specialty of dentistry, a pediatric is responsible of special need, and now maybe some countries providing a new program of the special need. However, this is one of my patients. He always, mother bringing him. When I put composite, he coming back this way, and until even because he cannot. He's active, same time he cannot control himself. No balance of his body, as you know, cerebral palsy. And the mother, I don't know, she was not really careful. So we reach for, actually, I don't know. I did treatment. I don't have it here, but he's under treatment. But you see, it's very poor prognosis here. And still, we have to keep the tooth. I did all what I supposed to do. Pulp extirpation gently, and irrigation, and then calcium hydroxide for like 2 months. And soon, I'm going to put TMG, as endodontists know how beautiful TMG working nowadays. MTA, sorry, MTA. What I said? TMG, okay, MTA. Thank you for correction. Yeah, so we do that. And the results very beautiful, actually, very beautiful. Once we do that, now we have recently, it's set within half an hour, right? Not like before, we have 20 minutes, yeah. Not like before, we have to leave it 3 days and come back. I just put and go for drink coffee, come back, do obturation. I have done a lot of cases, but it's not with me now. This is one of the cases supposed to do that and to prevent. And we have to advise the mother, she should take care of the child. He should not move alone much. And maybe if you use guard, it's not practical, this condition, and we ask him to use always, all the time. But the mother should take care of him or the father to avoid any trauma. I'm done. That's why I can find, where's Muhammad Sai, not here. That's why what I could find in my experience and my computer.
Thank you very much.
Welcome.
The floor is open.
Thank you.